Somatic symptoms and related disorders are a group of disorders that were formerly called somatoform disorders before the name change in the DSM-5. They are a group of disorders that are characterized by intense focus on the somatic symptoms, which are physical symptoms, of course, causing distress and disruption in one's daily living. It suggests a pattern of complaining about bodily symptoms, which suggest a medical condition, while as there's no medical explanation for the symptoms. This is what differentiates somatoform disorders from other mental disorders, as most of mental disorders' core thing is symptoms like moods, delusions, and hallucination, not physical symptoms like bodily pains. Different types of somatic symptoms and related disorders include somatic symptoms disorder, functional neurological disorder, which was formerly called conversion disorder, illness anxiety disorder, factitious disorder. I'm just going to include malingering, even though malingering no longer falls under this category of mental disorders. When tackling them one by one, firstly, we're going to look at the somatic symptom disorder, which is a disorder characterized by one having not one but multiple somatic pains, which are physical pains to be specific, disrupting their daily living. Individuals with somatic symptom disorder are not faking the symptoms, even though the symptoms may not be explained medically. Secondly, is the functional neurological disorder, in which there is a pattern in which symptoms or deficits affect the senses and motor behavior, strongly suggesting a medical or neurological condition. Then we have illness anxiety disorder. This is a disorder whereby patients are preoccupied with fears of contracting serious diseases or the idea of having a serious disease even when they do not. This distressing preoccupation are thought to be based on misinterpretation of one or bodily signs or symptoms. For instance, be convinced that cough is a sign of a lung cancer or a headache is a sign of brain tumor. Fourthly, we have infectious disorder. This is a disorder that involves people producing or faking physical or mental illness when they are not sick, or intentionally make a minor illness seem worse. Those with infectious disorder do this for no apparent reason. Then we have malingering. Malingering is when a psychiatrically healthy person physically or psychologically self-induce themselves with pain, exaggerate pain for secondary gain. Secondary gain may be getting drugs, narcotics, avoiding prison sentence for legal compensation, etc. Remember that this video is for educational purposes only and does not substitute any medical advice. For proper medical advice, please see a mental health practitioner that is registered with HPCSA. Don't forget to like this video and also to subscribe.